Dr. Hillary from Rangeline Chiropractic. Today we're going to interview Aaron. He is a physical therapist, and I was asking him to tell us a little bit about running and gait analysis. So Aaron, so glad that you could jump in and talk to us today. Tell us a little bit about yourself.
Sure, thanks for having me. So my name is Aaron Gegg. I'm a physical therapist at Team Rehabilitation at our Carmel location. I graduated 2016 with my bachelor's in management from Purdue and finished my doctorate in physical therapy last year from Indiana University. So done all my education here in central Indiana. I was born and raised here. Like Hillary said, we're going to talk a little bit about some running technique and maybe some injuries that we commonly see in the clinic, how to maybe avoid some of those things. Myself, I'm not as much of a runner. I'm more of like a weightlifter, play baseball, golf, that type of thing. But have dabbled a little bit in some running things as well. Actually was training for the Mini up until it got canceled.
I know, so many people.
But I actually was dealing with a little bit of some soft tissue, some running injuries myself. So I'll maybe get into that just a little bit as well. I know Hillary and I have talked about just the aspects of running gait analysis. Obviously, both of us seeing patients, maybe not specifically for running injuries more on Hillary's end, but for us in our clinic, we see a lot of people coming in, whether that's calf or knee or hip problems, and a lot of times stems back to running, and a lot of people have running as a goal. So that's often something we're working towards in the clinic.
Mm-hmm. Well, tell us a little bit about what some mistakes are. I guess maybe start with that. Who are the people that are making the mistakes and coming into you?
Sure. Yeah. A lot of times the people that we're seeing and the injuries that they're attaining due to running, it seems like it's more of like a load issue. So, someone maybe is training for a race, they haven't run in a couple of months, they jump back in and they do too much too soon. That's probably a pretty stereotypical way if someone gets hurt. They used to run, 5-10 miles. They haven't done anything in a month or two, and they jump back out there and try to do the same thing again. So just ramping up too much too soon. So that's something we talk about a lot with our patients, whether they're recovering from an injury or just kind of injury prevention in general, is kind of building up that chronic workload to avoid those acute injuries. Oftentimes, like we said, somebody might try to ramp up intensity back up to a level that they used to run at, and they're not ready for that. And so that's when we're seeing a lot of, muscle strains and those types of things that can also exacerbate maybe a chronic issue that's going on. Maybe someone has chronic hamstring issues, which is something that we see with our runners. And so, they have these hamstring problems and they don't necessarily address the issue. Maybe they rest for a little bit, but then they jump back in at the same intensity they were doing before. And that can lead to an exacerbation of acute injury and kind of lead that to being a more chronic thing. So that's a big thing for us is trying to avoid doing too much too soon. And so we talk about maybe trying to ramp up running schedules, trying not to do, maybe you're increasing 10%. Every week is kind of a baseline way to do that. Now, as you're in maybe a shorter duration run, you may be able to increase more than that 10%. But as you get up into your longer duration runs, maybe not increasing your load week over week by a lot. Another common mistake we might see is people not having a good recovery plan or kind of neglecting recovery. So sleep is the most important probably aspect of recovery in general. So making sure you're getting 7 to 9 hours of good sleep, especially if you're going to be ramping up a training schedule, a training regimen. So focusing on sleep, taking recovery days. I know being an athlete and being runners and people who work out, you don't want to just take a day off and do nothing. So maybe it's incorporating more of a spin, or you're doing some strength training in addition to just running. Maybe you're going to work on some tempo or speed work one day, and then making sure you have a good recovery day after you're working on, a hard day, a hard run, a long run, making sure you're getting good sleep, making sure you're getting proper nutrition, that type of thing. So it's all kind of builds up to a overall well-rounded training plan where you're trying to get optimum recovery, optimum nutrition, and complementing that by not doing too much too soon.
Mm-hmm. I noticed, and I'm sure you hear it too, but a lot of people don't stretch enough. So I'm sure you get that. And I think, really? there's still people out there that don't stretch.
Yeah, and mobility is definitely important, and also sometimes people they neglect stretching, but then they're also neglecting the strength training aspect of it. So we're looking at people who come in with calf injuries and hamstring injuries. Oftentimes we can help relieve that by loading the tissue and getting the tissue more resilient to that stress that's being placed on it during a run. So oftentimes, we're seeing that with the tendinopathy, and so the tendon responds well to loading, in addition to some of the soft tissue work that we're doing with those patients. But stretching and complementing that with strength training in addition to the running is definitely important.
Mm-hmm. Like, how often do you have your patients stretching per day?
If we're dealing with someone who really has a mobility issue and it's more of a soft tissue thing, we're probably looking at twice a day for sets of probably 3, and holding that stretch for anywhere between 30 seconds to a minute. Research kind of shows we need at least that 30-second hold, and so up to a minute is beneficial. Any longer than that, and benefits are kind of negligible. But we definitely want to make sure we're working on that mobility stuff, especially like a heel cord mobility. So doing calf stretching and that type of thing is usually where we see those people being pretty tight, in addition to maybe the hamstring mobility as well.
Yeah, I've noticed some patients that maybe don't run every day are not stretching. They're only stretching after that one time they ran, or and I'm like, oh no, you have to do that every day. You have to keep that going.
And mobility is definitely one of those things that has to be consistent, or you're not going to see those changes over time.
Mm-hmm. Yeah. What else are you finding that you're seeing come in?
A lot of people ask about like shoes. A lot of people, are coming in maybe with like a lateral hip pain or knee pain, that maybe running isn't their main goal, but they want to be able to do it ideally. Mm-hmm. Maybe they're not an elite runner, they're not training for races or anything, but they want to get out and be able to run, 3 to 5 miles or do a 5K. And so those are the people that it's real easy to get them up on a treadmill in the clinic and just have them jog for a few minutes and kind of see if there's anything that stands out. Oftentimes people who are maybe more of a recreational runner, and even people who are elite runners, they have more of a heel strike pattern. And so their heel's hitting first. Obviously when we're walking, that's what we want. But when you're running and you have that heel strike pattern, it's not allowing the quads to kind of absorb that force. And so there's going to be increased force kind of through the knee. And really you're kind of slowing yourself down with each step when the heel hits first. So we try to encourage runners towards more of a midfoot strike pattern. Not necessarily where you're running on the toe, but kind of right in that midfoot is where your heel's hitting. And that just kind of helps propel you forward a little bit. It makes it a more efficient running pattern. There was one study that showed that if you can increase someone's step rate, so now we're talking a little bit more about cadence, but if we can increase someone's step rate to around 175, 180 steps per minute, it increases the running economy by 11%. So that's going to just be a more efficient running pattern. And complementing that along with working on calf strength and calf mobility and that type of thing, as someone may be kind of working to change their gait pattern, they may have some other exacerbations of different injuries pop up. And so making sure we address those things all at the same time as well.
As you know, I love gait analysis, and I had it done before I met Aaron, but I thought what was really neat, like we learned about the striking in the midfoot. And as I was going, I remember her telling me, all right, start running. And I was like, oh no, like I am running. And she was like, oh, you're not going fast enough. That's why you're having more impact. And I was like, oh, like I thought I was doing good. And she's like, all right, I'm ready to watch you now. And I thought, well, this wasn't a warm up. This was me running.
That's funny. Yeah.
I just found that so fascinating.
Right. So my clinic director sees a lot of elite runners. He's a triathlete himself, and so sometimes that's the only thing he changes with the runners. He'll just say, hey, go on your treadmill or on your run for 1 minute and just count how many steps you're taking. And so oftentimes people that are injured are down in that 150 to 160 maybe steps per minute, and if the only change we make is getting that up to 170 to 180, oftentimes people are seeing a more efficient, more fluid running pattern, and that's helping with the issues that they're having during the run.
I find that so fascinating because I'm sure that a lot of people don't know that.
Right.
Yeah.
And
it's like, oh, it makes more sense once you start to think about the mechanics of everything. So we will have a lot of runners watching this, obviously, and I'm a big supporter and a sponsor for the Carmel Runners Club. So they do a great job, like running all around Carmel. So I want to give a little quick shout out to them. They do an amazing job. When people are doing like a gait analysis with you, could you kind of talk about that? Because I try to explain that to my patients.
Sure.
Like, you're on a treadmill. I just think that is so beneficial to have someone just watching you that knows what to look for.
Yeah, definitely. So all of our patients really we're analyzing gait, whether usually walking gait. Just when someone walks in the clinic, as physical therapists, that's something we're trained in a lot during school, is kind of analyzing gait and trying to find where someone's compensating and what their injury may be. But when we talk about runners, is kind of get them up on the treadmill. There's a couple of apps that we can use on the phone to kind of slow it down and look at joint angles and that type of thing, usually looking at them from directly behind, and then maybe a side view as well, maybe from the front. That way we can see if someone's having a lot of hip internal rotation, do we need to work on more glute strength and core stability and that type of thing? Are they midfoot strike, heel strike, toe strike? What's their dorsiflexion look like? Is that knee hitting and in a fully extended position? Are we getting a little bit of knee bend? And so just even doing a slow motion video on the phone, even without an app, can be beneficial to just kind of see, hey, what's this person doing? What's their gait look like? And some people, they may not have symptoms, or they may not have any issues until they get a mile or two down the road. So on one of my clinical rotations, actually, we would have patients run before they came to the clinic. Like, ideally, if they could get a run in, go do their long run, and then head right over to the clinic, and we could see kind of what their gait might look like as they tire. Because often as people get tired, that cadence is going to slow down. You're going to try to overstriding, and that can lead to some other issues like we've talked about previously.
That makes sense. I feel like most people that run should do a gait analysis, even if they feel like they're doing a good job, because you never know what you could fix or prevent an injury, and I'm all about prevention. Like, even if they say, I'm fine, I run fine, like, yeah, but do you? I mean, do you really know? I mean, you and I know a lot of things, and to have someone watch us run is still very beneficial, because sometimes you just can't see yourself.
Yeah, it can definitely be a huge benefit to identify things that may be, risk factors in the future, or just say, hey, like, I want to make sure I'm on a well-rounded program as far as doing the right strength training things, whether that's kind of glute core strength, make sure my hamstrings and my heel cord is resilient, to be able to do this run. How's my joint mobility look, that type of stuff. So it definitely could be beneficial, even if you're not having issues. Just maybe you're getting ready to ramp up for a race or run, and just want to make sure you're kind of feeling good, looking good, before you go out and start your training, and make sure you have a good plan to kind of avoid any of those injuries.
How hard is it to change from a heel strike to a mid strike?
That's a good question. I think some people probably have some difficulty with it if you've been running for a long time and you always have that heel strike. I think sometimes it depends on your shoes too. If you have, a big heel on your shoes that you're used to, that's going to kind of maybe encourage more of that heel strike pattern, and the shoe's going to absorb a lot of that cushion. If you're on less of a drop of a shoe, then it's going to encourage more of that midfoot strike. There's been some research on whether or not changing someone's running form is going to help prevent injuries, and it's kind of inconclusive. Obviously a lot of studies end up that way because they're not necessarily looking at certain things. And I think this study in specific was looking at asymptomatic runners, and so by changing the gait, they didn't see any difference in injuries for that group. But a lot of times, from just what we've seen in the clinic, by getting someone from a heel strike to more of a mid strike pattern that is having symptoms, it seems to definitely benefit them.
Nice. Awesome. Are there any other tips that you want to share with us?
I think that's about it. I think getting a good warm up in is one thing we haven't necessarily touched on yet. I know a lot of times as runners, you throw your shoes on, walk to the door, and then maybe you head on out for a run. So maybe getting a quick dynamic warm up in, whether that's some squatting or walking lunges, or even just a quick walk. I know I often will do heel raises, both with the knee straight and knee bent, to try to get the soleus engaged before you run. Can be very beneficial as well, to just kind of help avoid those acute muscle strains you get when you just hop on out of bed and head out the door. So
Yeah, you're right. That warm up is key, and I agree. I don't think a lot of people do that.
Yeah.
What's your take on stretching before running versus stretching after running?
I think if you enjoy it, it's definitely worth your time. There's definitely a lot of talk around stretching. There always has been and always kind of will be, I guess, in the rehab field. A lot of people that I follow on, Instagram and social media, people that are well known, either have a hard take on it one side or the other. You never need to stretch, or you should stretch all the time. So what I tell people is that if you enjoy stretching, if you feel better after you stretch before you want to run, then go for it. Do it before you run. It's not like you have to do it one way or the other. But definitely getting a stretch in can often help people feel more mobile. And if you definitely have some of those soft tissue restrictions in your motion, specifically probably calf, when we're thinking about running or lower extremity injuries, it's definitely important. I would probably lean more towards after a run, and definitely getting the dynamic warm up in before, but it's certainly not going to hurt to do it before and after, or either or.
Yeah, I feel like the last articles I read always talked about stretching afterwards. And it's
Right.
funny, a little old school people are going, well, no, I only stretch before. And I'm like, oh, that's not what the research shows now. But you
Yeah.
never know, Aaron, in like 20 years, it could be like, oh, only stretch before. And like
Right.
right now, we're in this phase of only stretch after. I mean,
Right. It's always changing. So it's
yeah.
kind of, a lot of it is built on patient preference for me, as far as like, if you enjoy stretching beforehand and afterwards, you want to do a dynamic cool down or you want to flip it. As long as you're doing something for that warm up and then getting the mobility work in later if you need to, I think that's what's important.
Yeah, that's some good points. I like the idea of like the squats and the lunges to begin with the walk. And
Mhm.
yeah, very good.
Yeah.
Well, thank you so much for being on, Aaron. And if you could post a link for your office underneath, that way if anyone wants to reach out to you or has any more questions. I know this was like brief and there was no pictures to show the running gait analysis, but it's really cool, you guys. I hope that you check it out and really think about, this season of running to really watch what you're doing instead of coming in with injuries so often.
All right. Well, thank you for having me on. I appreciate it.
Yes, thanks.